Welcome to QuickMedTalk, your online destination for medical lectures. Let's talk about adenoid hypertrophy. By definition, adenoid hypertrophy is hyperplasia of the pharyngeal tonsil. It only becomes symptomatic if it leads to congestion of the choana and eustachian tube. Most common cause of nasal obstruction in children between 3 to 7 years. Etiology. It can be physiological or pathological causes. Physiological. Adenoids gradually increase in size with increase in size of the nasopharynx and atrophies at puberty. Persistence of adenoids into adult life is uncommon. Pathological causes can be viral or bacterial infections, example S. aureus, Haemophilus influenza, and Epstein-Barr virus, allergens, and recurrent upper respiratory tract infection. Clinical features. On mechanical congestion of the choana, presents with adenoid facies, characterized by elongated open mouth face, short upper lip, thin nostril, prominent upper teeth, and high arch palate. Mouth breathing, hyponasal speech, chronic or recurrent rhinosinusitis, nasopharyngitis or epistaxis, obstructive sleep apnea, and halitosis. Mechanical congestion of the eustachian tubes presents with recurrent chronic otitis media, tympanic effusion, and conductive hearing loss, which result in velomental disorders, example, language velomental disorder. On investigations, we can do a lateral X-ray of the nasopharynx and rigid or flexible nasal endoscopy, which is called standard. Below is grading of adenoid on endoscopy. On treatment, asymptomatic adenoid vegetations do not require treatment. Adenotonsillectomy or surgical excision of adenoid is indicated for chronic or recurrent otitis media in children, chronic or recurrent sinusitis, and severe symptomatic nasal obstruction, example, obstructive sleep apnea. Treat the underlying cause of inflammation, example, intranasal corticosteroids for allergies or antibiotics for infection. Thank you. Do not forget to like, comment, share, and subscribe. In the bio, you'll find the link to our Instagram, Facebook, and SlideShare account.